let's, I guess, maybe see if we can do this in some chronological order.
Okay.
So can we start with you just kind of summarizing how you got to MSU to begin with? Where did you go to high school, and how did you get interested in biomedical science in general?
So my path to MSU, so coming from Renaissance High School over in Detroit, I had, I cannot remember on-sites. I think they were just on-sites where, you know, reps from Michigan State, U of M, different schools came to the school. They looked over everything, and on-site they would say, yes, you're admitted, or no, you're not admitted. So that was kind of my introduction to Michigan State. And so, and also my sister went to Michigan State. So kind of I had to come here additionally because of that. Why BLD? You know, a lot of people, I've been hearing the same story. Like they kind of Google it and they stumbled across it. It's never something that's like, oh, my mom was an MLS, or, you know, I know someone who was an MLS. It's like people stumble across it and they're like, oh, this sounds pretty cool. Let me dig my toes in. And then it's like, wow, this is actually really cool. I actually really like this. And that's kind of my story too. I wanted something in STEM, more medical, but not pre-med. I wanted something practical. I wanted something that after I get my degree, I can work and then use my hands and like just get my hands dirty. And that was a perfect fit for me.
Get your hands dirty.
I mean,
metaphorically,
yes.
Metaphorically, not
like
actually.
with stool and urine.
Because we wear our protective equipment.
We do.
So as an undergrad within the BLD program, can you describe some of your experience with the various classes? Any difficulties you ran into, any special classes that you really loved?
Starting off, to be transparent, coming from high school, I didn't really study much in high school. So first year of undergrad, I didn't study much and did decently well. My second year, I tried to like rearrange my schedule to where I could take different classes at the wrong time. But my second year, I took BLD 324, which is the hematology and hemostasis. And I ended up not doing well on the first couple of exams. So I had to sit down with the professor at that time who said pretty much these are your options. Like you can either do better in the course, but not do as well as you want to overall, or just retake the course, like fail it, retake the course. So I decided to fail the course, which was heartbreaking. That was kind of hard just because I had trouble like not letting that define me and not saying like, I have not failed anything before and I'm failing this course and it's on purpose. Well, partially on purpose, partially because I didn't study. So that was difficult. Overcoming that took a lot of reassurance in myself to know that I can do this. I'm in this major for a reason. How can we be better though? What steps can we make to move forward? And that was how I started to learn how to study, which that's surprisingly not taught. It's like different study techniques, especially in high school, I would think. So that's when that came about. I started doing more active recall with studying kind of Pomodoro technique, the 50 minutes on, 10 minutes off. I would just study for a long time and then take a break when my brain was tired. And yeah, that kind of really elevated how I learned, and I was able to really excel in classes later on. I think my favorite course was clinical chemistry with Dr. Thornhill. I really enjoyed that.
That would be BLD 302 and 402 now, because we've renumbered the courses.
Yeah, like that was 413.
Yeah.
Interesting.
So that was now the introductory level is 302 in your junior year, and then 402 is the advanced clinical chemistry.
I love that. Yeah. Okay.
So you said something interesting, and maybe about how did you get past this failure, right? You really had to separate I failed a course from I'm a failure, right? How did you manage to do that? Because you were a sophomore, right? How did it not wound your ego?
Oh, it did.
Okay. How did you get past it then?
How did I get past it was me sitting with myself and really reflecting and saying, if I sit and sulk, I'm not going to pass the rest of my classes. I'm not going to do well as I want to. I'm not going to be, an MLS. I'm not going to graduate. I'm not going to do this internship. So if I sit in this moment, let it wound my ego permanently, how does that benefit me? Instead of actually saying, okay, you can do better. We can be better. Let's, trial different ways of studying. Let's see how we can actually utilize different methods in order to pass both this class and be able to excel in later classes. So I think that was it's like I came to a crossroad. Where do I go from here? Do I want to stay in this spot or do I want to keep moving forward? And then to keep moving forward, we have to change. We have to make some changes.
So our laboratory major, our accredited program is limited admission. So you have to apply as an undergrad. What made you take that leap to follow what was clinical laboratory science degree, and now we call medical laboratory science?
I enjoyed the thought of having everything kind of in one package, having the undergraduate degree, the internship, graduation, and after graduation, you can take your certification exam and have a job. I loved having that all in one package. I was also dual majored with BLS as well, so I wasn't taking a lot of overlapping classes, but I did enjoy the tight knit group that was MLS or CLS at the time. Now MLS. A lot of us took the same courses, so a lot of us literally went from Kedzie over to Bessie if we had a class over there, to the library to study, here for lunch. We came back. I love that tight knit group that we formed, and yeah, like I said, I saw us all grow together, and that, looking back at it, retrospectively, that was probably one of my favorite parts, is having that close knit group and being able to graduate knowing, like, having that security.
So a lot of students don't really understand when they enter our program how the internship works. And they ask, how did you get an internship? Can you explain that process?
Sure. So generally with CLS or MLS, getting an internship essentially is getting experience in the clinical laboratory world. Essentially, you will rotate through, the hematology, the blood bank, the microbiology, and you will actually be, hands to the blood, hands to the stool, hands to the urine, and you're going to be applying all of the things that you learned in the classroom. Getting the internship is a couple of different methods, actually. MSU within the BOD program is amazing with their MLS because they will kind of do an internal match. So you will go to different sites if you choose, and that's what we were able to do. We were able to go to different sites, kind of take a tour, see what was offered there, and talk with the people there, network. And afterwards, I very clearly remember having to write an essay saying, this is my top choice, and I will accept, these other choices and things like that. And we had our advisor at the time to do kind of an internal match with a with a few spots that we have. And that's kind of how we got our internship for the MLS program. For BLS, that's more of an external match where there's a big system that you kind of go through to end up finding where you want to go to do your internship. And that's usually a longer period of time, usually about a year. And that's where you kind of, again, gain that same experience or for you to get your certification.
So just to make sure we're clear, once you were accepted to the CLS program, getting an internship was automatic. As long as you kept passing your classes, right? You were guaranteed an internship.
Almost definitely, unless there were like more people, but I don't think we've ever had that issue.
Right. Yeah. Okay, cool. So where did you end up training and where did you end up working?
I trained at Henry Ford, which was great. And then I moved over to Mercy Health System. They probably changed their name by now, but it's Mercy Health over at Muskegon, Michigan. So way West Michigan. And that's where I worked for about 2.5 years.
And so where did you work in the hospital lab?
I was a generalist, so I worked everywhere. I worked blood bank, hematology, coag, micro, chemistry.
Did you ever find a favorite area that you liked working in, or did you just like working in all?
It depends on the day. When you walk in and you can feel the mood of the lab, blood bank was having a bad day, or it depends on the day, of course. But my favorites, I don't know. I loved all of them just because you got to see, for me, I love to see everything and I love to know everything. So being a generalist and being exposed to everything I don't know, I loved it. If you have any questions, let me know.
Yeah, interrupt at any time.
Yeah.
So, and same online, right? If you have a question, just throw it into chat or raise your hand and we'll be able to see, okay? So you worked as a generalist and now you're in medical school. What was that always your plan to go back to medical school after your MLS, or how did that come about?
That was not in the cards for me. I did not want to go back to school at all. Once I got my bachelor's, I was like, that's it, great, I'm done. That was fun while it lasted. Then while I was working, I had lots of experiences that exposed me to the patients a little bit, but not enough for me to want to be completely fulfilled, I'll say. There were a lot of times, and I kind of laugh looking back at it, where I would harass, I'm pretty sure I would harass the physicians and the PAs, the nurses. It's funny back on it, just because I wanted to be so, okay, sorry, I got distracted. There's a question in the chat. Just because I wanted to be so involved in the patient care. And so there were certain specific experiences that I was like, okay, I want to be there in front of this patient. Like, I want to put my hands on the patient. I want to talk to the patient. I want to see, like, why are their labs aberrant? Like, what is going on here? And I didn't have that. Obviously, I didn't have that exposure being in the lab. I felt kind of, removed from it. So after having those experiences, I decided, reflected again, lots of introspection. Where can I go from here? I'm an introvert. Do I actually want the patient care? Or am I just a nosy human being? Maybe a little bit, right? That's what medicine is, just being nosy. And that's when I was like, no, I want, well, both. I'm very nosy, but I do want to be more involved with patients. I love listening to people's stories. I love talking with people. And that's what kind of brought me to apply to medical school. And I think it's part of the reason why I'm here today.
So why not PA? Why full med school? I mean, did you consider PA?
A little bit, but full transparency, I like to have control. So PAs, like, while PAs, they do have a lot of autonomy now, especially now. They are still considered, and this is not a bash or anything like that, this is the truth, they are still considered mid-level providers. So they still have to report a lot of things to the physician. The physician at the end of the day has a final yay or nay. So I wanted to have the final yay or nay.
So you said you talked to a lot of physicians and nurses and whatever while you were working as a medical laboratory scientist. Mm-hmm. Did you get to shadow any of them? Did you approach? So which particular areas did you shadow, and what was your experience with that?
Yes. So one of the ER attendings was so sweet. She loved having students and shadowing, like, just people to shadow her. So she allowed me to do that for a very short period of time. It got busy. I did shadow, of course, a lot of pathologists just because they were accessible and they were there. They also love to have people shadowing them as well. Throughout the time, though, I did not get a chance to shadow any hospitalists, like anyone in the hospital on the floors, just because by the time I was actually sure about medical school, that was like just the beginning of COVID. Like, that's when the cases started to ramp up, and that's when everyone was like, okay, what's going on here? So that's when I kind of backed off with shadowing, and then it blew up. So I'm glad I kind of didn't shadow. But yeah, I was able to make a lot of connections with nurses and PAs and doctors, and they said, keep me in the loop if you need to shadow or anything like that, but I didn't need to.
So medical school, applying to medical school is a pretty daunting task, right? Mm-hmm. You got to study for the MCAT, you got to take the MCAT and get a certain score, and then apply, right? Mm-hmm. And they have the online application system and all that. How did you learn how to navigate through that whole process, and like which schools you wanted to apply to or not?
Mm-hmm. Did you plant this question?
No.
Is this a plant?
Is it a plant?
Is it? I reached out to Mary Ann.
Oh,
and she got me in touch with an MLS alum who was in medical school.
No, that wasn't. That was an honest question. I didn't know that.
It was a planted question.
No, it was not a planted question.
You and Mary Ann were talking.
No, no, I was not. No,
that's
but it's a question that students often ask,
sure.
right?
Yeah.
And especially in your case, you were now off campus. You had already graduated
Right.
3 years earlier, 2 years earlier, when you
Mhm.
decided you wanted to do this.
Right.
So you weren't plugged into all the usual resources. So what did you do?
Well, I don't know why Marianne popped into my mind. I was like, Marianne, I need help. Like, she was always the type of person I could reach out to. And she was like, I actually know an MLS alum who works, who's in medical school, I think at Michigan State, CHM, and was working at Sparrow as a tech, like on the weekends, like she would pick up shifts. And she was like, get in touch with her. I think she would be a great mentor. Got in touch with her. We were on the phone for like 2 hours, like going back and forth. She's so sweet. She's a wonderful human being. And that's how we kind of got, well, that's how I got started in what do I need to do first? Like, what are the first steps? What do I need? How should I study? Was she working like while she was studying for the MCAT, things of that sort? Kind of what do I need to be prepared for? Dr. Zhang, who also worked here before, she's an MD. Well, MBBS, I think, or MD.
No, she's an MD.
She's an MD. I got back in touch with her after a long period of time, and she actually walked me through. She's like, we don't know everything, especially now with everything that's changing, but these are people you can get in contact with. These are people that I might know, and these are some of the things that you can do in order to get prepared. So those are some of the things that I got started with. Writing like my personal statement, my activities and things of that sort. I actually got in touch with the MSU Writing Center, and because they helped, I was like just at the end, because I think they help grads up to 2 years. And I was like right at the end of it. I was like, please read this before I'm done.
Hey, that's smart.
Yeah.
That's just good. That's just smart.
So bottom line, you networked, right? You took
did.
advantage of the resources, the BLD family that you knew, and reached back to us. So, Marianne was an advisor in our program previously. Dr. Zhang taught hematology for us for a while, but you still felt comfortable
Yes.
coming back, and that's important. So taking advantage of your network is really big.
Mhm.
So how many schools did you end up applying to then? Did you apply out of state or just?
Yes. I did apply out of state. I cannot recall how many schools I applied to. It was relatively broad, but I just knew I wanted to stay closer to home throughout medical school just because of the support system. And I'm from Detroit, so staying a little bit closer to the support system. I would not have minded moving away, but just increased tuition. Having to deal with all that and then moving in such a short period of time. But applying to medical schools, you kind of have to have your options open. You can't really be as, I'm only going to apply to one school and hope and pray that I get into that one school. So apply broadly. And I think it really just worked out in my favor. Everything just fell in line, surprisingly.
All right, so you said there was a chat online. Is there a question?
I know we had this question during class, but a lot of people mainly talk about medical school. Could you talk about some of the options you've seen people take? Of course. So outside of medical school, I don't think there's an alarmingly large percentage of MLS grads that go to medical school.
It's when we've looked at it statistically, we followed grads 10 years out from graduation, and about 10% total attended either graduate school or medical school or vet school, one of the health professions type schools.
Okay.
So yeah, not everybody does that.
Yeah. So that's awesome. So other options or other avenues you can take, you can work as a medical laboratory scientist. You can work as a tech, you can work on the bench. There are leadership roles associated with that. So depending on the institution, of course, there are different supervisory, managerial roles. With that, depending on, again, what institution you're at, you can be involved with training. I was actually involved with training new people and interviewing new people, hiring new people. You can work with the big instruments or the big people who make the instruments, such as Beckman Coulter. And you can work as the troubleshooter, the problem solver that's behind the phone whenever the instruments break down, or the person who's coming out and actually bringing in new machines and working on, sales and things of that sort. You can actually be, what a recent grad is doing, he's actually being trained on newer materials, newer instruments. You can work with like quality improvement. I know a lot of people do quality improvement and things of that sort if you're interested. There's surprisingly a lot of different avenues. Of course, you have to stay relatively STEM related, but there's
Well,
still a lot of
there is information systems, right? We
Oh,
do,
true.
A
Yeah.
lot of our MLS grads also end up,
Mhm.
picking up coding,
Oh,
and then they write the
Yeah.
code that allows the
Yeah.
laboratory instruments to communicate with
Mhm.
the medical records,
You're
the
absolutely
electronic
right.
medical records.
Yeah.
So, Dr. McQuiston, right?
Oh, yeah. Yes.
Has-
yes, yes.
Has her juris,
Mhm.
doctorate degree, so
Mhm.
she was a lawyer for a
Yep.
while in biomedical law. So, I mean, there's a lot of things you can do with it. I think we try to prepare our graduates so that they have a very broad, well-founded biomedical education. So anything that can apply to that,
Yep.
it works well.
Great.
So tell me about your experience in medical school. So that you're starting your 4th year now, you're pretty far along. How has it gone? Like, what things did you not know about med school before you got there? Like, what were some unexpected, what were some expected experiences you had?
Before you answer that, can I just add on to that
Oh,
question? Because that goes
absolutely.
right to my question. So I'm also from Detroit.
Okay.
And I was wondering, to piggyback off yours, how did it, like, what has the transition been like going into medical school, going through medical school, especially being from Detroit, where it's not always a lot of like resources and support?
Good question. A lot of questions here. Okay, so how did I transition throughout medical school, not necessarily before? Okay. Throughout medical school was hard just because I think my class was special in that we were the COVID class. Like, we are known as the COVID class. We started during COVID. Our first 2 years were during COVID. And this past year was my 3rd year. And that was iffy. Like, ooh, are we going back to the hospitals? Is it safe to go back for us students to actually learn in this environment? So that was difficult because it was just, it was universal. It was a period of just, we don't know. We have no idea. But the school that I went to was able to accommodate to us like really well. And obviously it's something that we're using Zoom now, like, something that we were able to accommodate to pretty well. Aside from that though, one thing that I was not expecting was studying. I brought in BLS study habits to medical school, which was fine for BLS because it was, a couple classes, 4 classes, but it was all related to each other. Like, I could study off of one thing and build off of that one thing and then, keep kind of studying that way. Medicine is, okay, here's a GI tract from the beginning to the end. But I mean, from the beginning, like in the embryo, in the beginning. And then to the end is like when you're a full grown adult. But also here's some microbiology, and here's some pharmacology, and here's some disease pathology, and here's the biochemistry, and here's a little bit of this and that and this and that. Studied all in 2 months. So I brought in study habits that took too long, essentially. It took too long for me to go through and retain the material in a timely manner. So I had to kind of relearn again how to study. How do I study efficiently, and how do I study in a way that's time efficient, essentially? So that was one thing I was not expecting, and everyone studies differently. So one thing that a lot of people raved about is Anki, like this flashcard thing. People love it. I hate it personally. But it's kind of, sometimes it's this this pressure. Oh, it's working for everybody else. Like, why is it not working for me, kind of thing. And that was something that I had to get over. Like, just because it works for someone else does not mean it works for me. Like, everyone studies and learns differently. So, and then how did I get in there? No, like, without having a lot of resources, especially in Detroit, reaching out to people, definitely. I don't know about your personal background, but my sister went to college, so I'm a 1st gen. Technically, my sister's older than me, so I guess we are the 1st gen. But outside of that, I don't have people in my family who are in medicine, who went to post-secondary schooling or things like that. So going to them and asking for help was like, I support you. I have no idea what's going on, but I support you kind of thing. So having that was nice, but always knowing that there are, people to reach out to. Dr. Hoyt, I reached out to you about the COVID stuff, like while I was still in MLS, and she was like, here's an article. Like I was just looking through my email. Here's an article that I just found out. And just having that community was essential for me. Absolutely.
A lot of people don't know, but I know because I talked to you enough. You were actually the student director of the admissions board, right? Last year?
For the past 2 years.
For the past 2 years.
Mhm.
So you reviewed hundreds of student
Thousands.
applications and interviewed students and things. You have the insider's perspective that many of our students don't have. So what's some advice? I mean, did you take the right approach for your personal statement? I mean, what's a realistic minimum GPA you have to have for medical school? Is it, I mean, you clearly had failed a course and then repeated it. I mean, is it reasonable to have failed 3 courses and repeated it? Is one like, that's about it? I mean,
Right.
what are the practicalities of getting into medical school, and what are the things that make students stand out or that they're like, no, they're never getting it?
Yeah. Okay, love that question. So it definitely depends on where you want to go. Kind of break down this question a little bit. So for GPA, for the most part, you can look up like what's a good GPA for medical schools. I think right now it's like a 3.7, 3.8-ish is like a good, pretty much average GPA that a lot of med students will get overall. Science GPAs, I think about a 3.7 and up to 3.6, 3.7 and up to. Also, MCAT scores matter. The lowest score you can get on the MCAT is a 472. Right now, the average MCAT score for like a 4 short interview is about a 510. So just keep those metrics in mind. You also want to think about where you want to go in regards to the school's personal mission or the school's mission. So if the school, for example, Wayne State is very focused on community service in addition to research, but it's a very community service oriented school. They focus a lot on primary care and giving back to the community essentially. So think about when you're applying to schools, does my personal mission align with the school's mission? Do I see myself going into a school with community service if I don't really like community service, or if I only did it just to get my foot in the door and get an interview kind of thing? So additionally, like research, underserved populations is very big right now. Mentorship, things of that sort. What was your questions? I'm trying to think.
Focusing the writing, the personal statement. What's a good personal statement? What's a not great personal statement?
My least favorite personal statements are, and I quote, or something along the lines of this: I have always known I wanted to be a doctor since the age of 2 months, and everything has just fallen into a line for me, and everything has just worked out perfectly, and now I'm here in medical school right now. Like no struggles, no story. Where's the depth to this story? Do you have family members that went through something? Did you go through something? Like, I love to hear about people's paths to medicine. If you kind of always had like an inclination to go into medicine, then that's perfectly fine. But what experiences did you have that kind of solidified medicine for you? What did you do in order to kind of explore medicine even more, or explore different avenues of medicine? Shadowing is great. Shadowing is wonderful. Community service is too, but community service isn't just working at a soup kitchen. Community service is, what did you see in that soup kitchen that made you want to keep coming back? What did you see when you were out, handing out the blankets to the homeless, or working out at the churches and things like that, that really made you want to say, a life of servitude is a life that I want? Because that's what, being a physician or being in, healthcare just in general really is. So Also, depending again on the school's mission, what is your personal mission? Do you want to be a neurosurgeon? Do you want to focus on research? Do you want to, do these big things? What have you done in order to say, yes, this is the life for me? And what do you plan to do after, like, you get into medical school, things of that sort? Personal statements, they're 5330 characters or something like that, like 5,000 some odd number, 5,000 some number of characters. It seems like a lot, but once you start writing it out, you're like, oh my gosh, I don't have enough space to write everything down. I don't have enough space. So definitely have people read your personal statements. I, again, use the Writing Center. And even with using the Writing Center, I use different people in the Writing Center. I made sure to make an appointment with different people just so that I could get different perspectives on the people that are reading it. And I wanted it to make sense because I use definitely an experience to start off my story from the lab. I use an experience that I had. So when they were reading it, I said, can you, a layman, read this and it makes sense to you? And that's important too. I think that answers personal statement metrics. And I can talk about interview stuff too, but that's like far down the line. If not, doesn't matter. Unless you have questions about it.
No.
Okay.
So you mentioned at one point that when you went from high school to BLD program, you had to change the way that you studied.
I had to study.
And you had to, okay, I'll take that back. Then
Yes.
You had to start studying.
Yeah, exactly.
But then when you went from BLD to medical school, you had to make your studying more efficient.
Right.
How the heck do you do that? What did you do? You said
You're like, yes.
the Inky,
Yeah.
quizzing thing didn't work. What did you do to shorten it and make it digestible? Because clearly, if you are so involved that you're the student director of admissions, that's really time consuming. So how did you fit that in on top of medical school?
It depended on the lecture material for sure, but for the most part, I was able to kind of read over, obviously, the lectures. I work better with seeing things in motion, like not necessarily looking at a picture. Like looking at a picture helps to kind of solidify things, but seeing things in motion makes sense to me. Seeing how the digestive tract works makes sense to me. Seeing how blood, the white cells attack, makes sense to me if I can see it. So that helped. If I can find any like videos or any like moving pictures, I don't care, whatever helps me to kind of visualize it, to kind of solidify it. I didn't like Anki per se, but I do like flashcards. So I did use Quizlet a lot too. That's like a very basic level, like flash. I love Quizlet. It's so flip it and that's it, like I love it. I also utilized active recall. So quizzes, even if it's me making up my own quizzes or me searching for other people's quizzes. A lot of people go through medical school and a lot of people end up having the same material. So looking up quizzes that I can use to recall the material. And my school actually offered like weekly, what they call formatives, which are just weekly quizzes that we can take too. I guess using more of that active recall and not so much of the sitting, reading, highlighting, which is what I started doing in like rewriting lectures. That's what I did. I used to waste so much time to rewrite lectures because I'm a writer. I love to write things out and that helps me. But then I had to sit with myself, like writing all of this out is a waste of time and you're going to get carpal tunnel. So what can you do to kind of shorten that? And it was learning how I learned best, which is seeing things. And I mean, it was trial and error too. I didn't like get it on the first try. I had to fail at Anki. I had to fail at, rewriting up the lectures too. No pressure.
You're pretty much like answering them as you go, and we're asking like similar questions too. So
Okay. So, what do you think it is? First of all, if you compare your abilities in medical school to other students who you're in medical school with, do you think that your MLS background or the BLD courses that you got prepared you well? Are you, holding your own there? How does that look for you?
I'm one of very few people that had a career before medicine, and then even at having a laboratory career and then having a clinical laboratory career on top of that. I am at least 6 steps ahead of other medical students, like knowing especially what's taught throughout MSU-BLD. They really know how to teach students the clinical picture as it correlates to the lab values or to what you see under the microscope or what you see, in patient's blood. It's amazing for me to look at it kind of from the other way though, because we would study lab values and then say, okay, if their sodium is high or low, then this is what you would, suspect from the clinical picture. From medical school perspective, is the patient comes in with this, what do you expect from the lab values? And I'm like, oh, well, I know this already. Like I've studied it the other way. Like I already know this. So when we had to do like case-based learning or team-based learning, which is basically a patient comes in with X, Y, and Z. They come in with, lab values of this, and that. What do you suspect is wrong, or what other labs would you get, or whether they're this or that? I got labs like that. I gotta be like, I got labs. Don't worry, guys. I got this. And I even have like, and not to, this is a humble brag, but I had a professor that was actually genuinely surprised at, how much I could explain about, microbiology, because the specific thing that we were learning about that day was micro, and he was a microbiologist. Obviously not the laboratory route, but I was just able to talk with him about that. And he was like, oh, well, what's your background? And I was like, oh, well, it's in medical laboratory sciences. And he was like, oh, like that's not really known about, especially for more research geared scientists. So I was able to kind of bring a new perspective on that.
As an undergrad, you talked about the cohort that you really got pretty tight knit with when you finally made it into the CLS, but how else did you engage with campus? Did you have things you did outside of the major? And was that, do you think that was important for you?
It was, and I think I did too much. I love to be busy, obviously. I think Dr. Hook, by now, I do love to be busy. I do love to have a lot of things going on. And that stems from high school and even before that. So in undergrad, I worked quite a few jobs. But my biggest job that I worked with was with UAB. I was actually their desk receptionist, but then it was a desk supervisor position in the
UAB? University
Activities Board.
Activities Board.
So they hold all the big old events here. I also worked over at the biochemistry building, the BMB building that we passed over there. I worked there for a little bit. I worked at Briggs as a laboratory tech for a little while. I also was involved in the Liberty Hyde Bailey Scholars Program, which is an amazing program. I'm going to just plug that in here right now. It's an amazing program. It's so that you can, it makes you more well-rounded. We were able to take the 16 personalities, like the Myers-Briggs test, and they were able to give that to us just so we can learn more about ourselves. Like they're invested in people so that you can learn about yourself, how you learn, how you interact with people. And they allow you to be teachers. They allow you to interact with the community through community service and have leadership positions. I actually had a lot of leadership positions through there too. So that's a program that's near and dear to my heart. With the opportunities that they were able to give me, I was able to talk about that a lot in my medical school interviews too.
So I'm sitting here listening to you and I'm thinking to myself that, wow, you really moved outside of your comfort zone.
I did. I'm an introvert.
You're what?
I said I'm an introvert and I had to talk to people.
You're an introvert. Yeah. Okay. I'm having a hard time believing that. Okay. So you've always been generous with your time. Whenever I email you, you're like, oh yeah, I'll be there. What day? Oh, perfect. I'll be there. So what makes you want to give back? What do you think is that draw?
There is something deeply intrinsic in me that loves to serve. I don't know. It's not necessarily in a way that's like helping someone get to a different place or anything in that way. But if someone asks for help, for assistance, for mentorship, for can you come speak to people? Can you drop me off at the grocery store? I don't know. I love to be like a source of help for someone. And no matter in what capacity, I just like to be someone's person.
So you're reaching the point in medical school where you have to start thinking about
I know.
what kind of doctor you want to be.
I know.
And what are you've had to rotate through various
Mhm.
departments. And do you get some choice in medical school about which rotations you do? Are there ones you always have to do?
No to your first question, yes to your second question. All students have to do, and I can list, do you want to list them?
It's your choice.
Okay. See if I can remember them all. Neurology, psychiatry, family medicine, internal medicine, pediatrics, OB-GYN, and surgery. Those are the required like core electives that you have to go through. However, there are core rotations, but there are electives within those rotations that you can take. So for example, in internal medicine, I was able to do an ICU rotation and a cardiology rotation. And then with surgery, I did a urology rotation and something else I can't remember right now, which is a shame because I just did it. Ophthalmology. Yes, that was very interesting.
And so, and then do you get other options? Like you didn't mention pathology.
I did not. So unfortunately with pathology, you don't get exposure to that until fourth year, till you have more autonomy with your schedule. Just because third year is a time where you're exposed to very general patient, clinical cases, pictures, things of that sort. And that's more of a time for you to learn how to be a doctor, essentially, kind of be at least a student doctor in that way, because even as a pathologist, you still have to know how to talk to people. You still have to know how to talk to patients. I worked at North Ottawa Community Hospital, which is a very, very small community hospital, where the pathologist actually did the fine needle aspirations and the bone marrow biopsies. So you still have to have that patient interaction. You still have to talk to people. You still have to know how to use an ultrasound machine, things of that sort. And that's the stuff that you get in medical school. You don't really get a lot of that training in pathology unless you go to like a smaller hospital for your residency training. Could you imagine?
Yeah.
As a pathologist.
So what, do you have an idea what you want to do? Now that you made it through at least some of those rotations?
Yes. So in the beginning, I said pathology, because why not, right? I have the exposure. And then throughout second year, at least at Wayne, we have what's called the clinical experiential clerkship, which is basically pre-rotations. You shadow an outpatient physician through their clinic workday. And you get to talk with patients, you get to, practice physical exam maneuvers, things of that sort. And I shadowed an internal medicine and pediatrics physician. At first, I was like, this is insane. Like, why would someone want to see adults and kids? Like, this is crazy. But then as I started talking with the patients and seeing the kids, and I don't know, I was like, now I see why people do this. Like, I can see why I love this. So then I was thinking, okay, maybe a hematologist, maybe hem-onc. But then that will require me to do a fellowship in hem-onc. So I was still having to do internal medicine first, essentially. So then I got through that, what we call CEC, that clerkship in second year. I was like, okay, I really kind of like people now. And I got through my second rotation. My first rotation was OB-GYN in third year. I love the moms and I love the babies, but I didn't love when the mom was pregnant. So taking care of moms while they're pregnant, there are drugs you can't take, there's this you can't do, there's that, there are a whole different subset of rules and regulations for pregnant women. I love the newborns. Give me when they're fresh, give me the newborns and give me the moms. But that period, that 9 months, OB-GYN can have them. So that's why I interned medicine in pediatrics.
So when you went into it, you were thinking pathology.
Yes.
But you completely, pathology and pediatric internal med is very different.
Yes.
So, you kept your options open.
For sure.
Did you do that as an undergrad? Did you have to do that as an undergrad?
Probably, but I didn't. So first year, I sat down with Janelle Golding. I don't know if you remember. I love her. Love
Asked her in the
Janelle.
parking lot this morning.
Did you?
Yeah, I
Oh my
did.
God, I love her. So she was MLS or CLS, BLS, long time ago. And she was talking to me about the major and I was looking into it. And she's like, this will be a good fit for you. And as soon as she said that, I was like, tunnel vision. Like, this is all I want to do. She was telling me about all of just the advantages of having a program such as this and how much it has evolved now into the CLS program at the time that it was, and having that program, like I said earlier, just having the security in that program. So yeah, no, I was not open to any options. I found my passion in kind of medical laboratory science, and I stuck with it, and I'm glad I did, because I wouldn't be where I'm at now if I didn't.
We're getting close to our end of time.
Oh, is
Any
it?
questions from either online or here? Anything else you wanted to know?
Well, I have two questions. You had asked it earlier, but I didn't really catch it. As far as like, how did you bounce back? Well, obviously like retaking classes, of course, but how did you sort of bounce back or maybe articulate to the admissions officers about like classes that you probably didn't do so well the first time?
Yeah, that's a good question. So I can very clearly remember when I had my faculty interview for Wayne, actually, with a faculty member. He had my application like, all right, so here's your grades, here's your personal state. Like, he had it printed out, and usually a lot of people don't do that. So I'm like, oh my God, okay, he's gonna see that I had to retake that course, and I failed it. So he asked about it, of course. And additionally, what I did was, let me try to beat someone before they ask. So I talked about it in my personal statement. I talked about how I bounced back from an adversity, and that was something that I had to learn how to kind of pick myself back up from. And that was something that they actually really love to hear about, is like, how do you get through life knowing that life is going to kick you in the butt, and how do you get back up from that? How did I kind of talk about it was I went through the process of it. Like, I kind of exactly how I explained it earlier was what happened, what was going on throughout that time. And I went obviously more into detail. Like, I was working too many jobs. I was too focused on not studying and focused on like trying to work and do other things. And I wasn't really a studier, I guess, at that time. Like, I didn't really have the habits of studying. So one thing that they love to hear about is, great, that's what happened in the past, but how did you change that? And how do you plan on changing that throughout medical school and beyond? And that's what was definitely articulated within the interview part when they brought that up. Does that answer your question?
Yeah.
Okay.
And then my other question, so Wayne State School of Medicine is like, that's my dream school.
Okay.
Ideally, that's where I want to go.
Okay.
I'm a sophomore,
Okay.
to kind of give it like context, but I guess like, do you have any advice, or like, I know you talked about understanding their mission and connecting it to yours, and then kind of centering around community service, but like, what other little
Yes.
things, you know?
Oh, you want some pointers, some cheats. I got you. You're a sophomore, so you're starting off early, which is beautiful. That's really good. Community service, like I said, it is important, but why are you doing the community service? And for you, remembering that being a physician, if you're thinking about medical school, which I'm assuming you are, is a life of servitude. It's not just, oh, I get through medical school, I get through residency. No, it's a life of servitude and learning. There are going to be constant changes, even with a laboratory, even with my short stint of working in the laboratory, just in medicine in general. New machines are coming out, new assays, new testing assays are coming out, new this and new that. So how do you see yourself in the long term? Do you see yourself being a long-term learner? Do you see yourself being think about it, how many old physicians do you see? Like, honestly, how many physicians are like older than 70? Like, they're not retired.
Yeah.
But they still love it. They love what they do. They love to talk to people. Do you see yourself in the long term doing that? And like having all the responsibilities of a physician at that time as well. In addition to that, it's like kind of a side note. Are you like a first gen?
Kind of.
Okay.
Yeah.
Is there any other doctors in your family?
I have a pharmacist and a nurse.
Okay. Do they get asked a lot? My knee hurts. Like, what's going on with my knee?
Yeah, there's
That'll
a
be
lot
you.
of-
Yes. So that's something that you're gonna have to deal with. Like, are you ready to have to answer those phone calls? Like, are you ready to at your brother's baseball game, like jump into action if something happens? Like, that's the kind of life that you kind of have to commit to. And if you're going to medical school. So think about that just for yourself. Let's break this down. So application process revolves around your activities. So leadership activities. We love to see if you were able to step up and lead something, bring up something, start an organization, start an initiative, anything like that. Volunteerism. Obviously, it's strongly recommended or something like that. It's required, but they say it's strongly recommended. Definitely, I would say as a pro tip, don't do a lot of short stints of volunteerism, if that makes sense. If you go to a soup kitchen once for an hour, and then you went here once for an hour, that shows me that you did something just to say that you did it, and not because you actually enjoyed doing it. If in the beginning, though, you're trying to figure out what you wanted to do, and then you stuck with something for a longer period of time, that makes sense. And if you can explain like your passion with that, okay. Research, if you're interested in research, I will say I did not do research in undergrad. So it is absolutely not a requirement, but if you want to, that's perfect. And then they are adding on activities now, like extracurricular activities. We like to see that. Do you like to dance? Do you like to bowl? Are you a professional golfer or something? Like, were you on TV at some point? We like to see that people actually are people outside of like school and things of that sort. So that's application. And then your personal statement, of course. MCAT is a beast in and of itself, studying for that, making sure that you are as well prepared for that as possible. And remembering, and since you're asking this question now, which is wonderful, your biochem courses, which I hated biochem personally, I cannot stand it. Your chemistry courses, your physics courses, and your sociology courses, like the ISS and stuff like that, that's on the MCAT. So like when you're in it, be like, if you're having one of those days where I'm like, why am I doing this? Like, what is the purpose of me doing this? Say, this is for the MCAT. This is for the MCAT. And that's how you kind of have to get yourself into it. I didn't realize that until after I was studying. I was like, I vaguely remember this from like 6 years ago. So that's the MCAT. And then the interview portion, that is going to, it depends on people. I would say if you can get more than one interview, that's perfect. But get a practice interview in first, a mock interview. I don't know if Dr. Hoig, you do any type of interviewing or anything like that. No. I know that
they made in the peer advisors, like NATSI and the pre-health advisors, I think they do some mock interviews.
I think I've seen those.
Yeah.
Oh, perfect.
So they're available, just not here.
Perfect. Definitely practicing your interviewing and even looking up questions on the internet and kind of practicing with yourself. Like in the mirror, it's gonna be awkward, but those are those moments where you're like, okay, I gotta, get out of these jitters and like be more comfortable with talking about yourself. Like you have those maybe hour and a half to brag about yourself. It's gonna be the most uncomfortable thing you have to do, but you gotta do it. Okay, I'm done.
Thank you so much. I really appreciate you taking the time.
Of course.
And helping our students.
Thank you for inviting me.